Hi, this is Paul Wieck again, Chairman of the Coles County Democratic Central Committee, with the second of a series of messages I have about American politics and the political parties and the differences between the two. If you recall, the first time we talked about government is simple. We elect representatives to A, decide how much to tax us, and B, how to spend the money. And sometimes we pool our money together, and that's how we figure out the differences between the parties. One party pools their money and wants to use it for people, for individuals, for human beings. The other folks tend to reduce contributions of the wealthy and businesses and redirect dollars to benefit the wealthy and businesses, and theoretically the benefits will indirectly trickle down. So the one basic way to tell the difference is to follow the money and see who benefits. So let's apply this concept to our healthcare debate. Three things Americans have agreed on from the beginning that are too important for profit. We're not going to try to make money on it. We're going to pool our money together to do three basic things. First was the military. Second, public education. If you recall, we came from a country that you didn't get an education unless you came from the right family or you were wealthy. And three, infrastructure, safe roads, bridges, police, fire, safe water, safe food. So, should there be a fourth leg to the stool? Do Americans have a fundamental right in being a citizen to have access to basic, adequate health care? Should health care be for profit, or is it a privilege of being a citizen? Well, for those who are 65, or veterans, or military, we've decided that question. We believe yes, that's a fundamental right. And other countries, yes, they have payroll taxes. England has 6% payroll tax and they're government employees. Canada uses private providers and they have a payroll tax. But what about the rest of us? If you're not over 65, not in the military, where are we at? So, the problem is we have a health insurance industry, we have a pharmaceutical industry, and a medical device industry. All of these depend on America as the cash cow. This is how they're making our money. Hundreds and thousands of jobs depend upon it. So, Obamacare, or officially known as the Affordable Health Care Act, tried to make a compromise to try to balance these issues. The compromise moving forward is we'll still use private insurers, we'll still have private health care providers, but we'll have basic protections from abuse, for profit, pre-existing conditions, lifetime maximums, termination of coverage if you get sick, keeping your kids on at before 26, and 20% overhead limit. In other words, your insurance company, if they don't spend 80% of the premiums on health care, they have to refund the 20% or what they don't use to their insured. The industry was okay with this. Mandatory coverage meant more customers. We may not make as much on each customer, but we've got more customers. And there were tax dollar subsidies paid to these private insurance companies for those that couldn't afford insurance in full. And we have Medicaid. And all of these areas are subsidized by our money that the private insurers got to benefit from. And in fact, we figured that there was going to be some problems with the Affordable Health Care Act, and there were some protections for the insurers in case things didn't work out as we thought. Now, the political left wasn't happy with this deal. Why are we using our tax dollars, siphoning off money, for-profit companies? It only costs 3% to administer the VA and Medicaid and Medicare, so why should these folks get a 20% cut, a 17% profit for being the middleman, getting doctors to take less and people to pay more and just taking a cut out of the middle? Think of the direct reduction in staff that a hospital or a doctor could have if he didn't have to worry about whether the billing was coded right. Secondly, our money's going to private companies. Our money's going to private profit. Now, the right, they weren't real happy with this either. We have an expansion of tax dollars for Medicaid coverage. We can't reduce taxes as much on the wealthy and businesses. And we're covering low-income, working-class families and the unemployed. And it's the theoretical government control of your health care, death panels. But more importantly, that additional payroll tax is contributed by the employer too. For now, we pay 1.45% for Medicare, and your employer matches it. So this was going to cost some businesses some money. So the current debate opens up the question, why have health insurance at all? We can provide adequate basic care with a single payer system through approximately 5.25% payroll tax. Think of the personal freedom that gives each and every one of us. You aren't stuck in a dead-end job because you need the insurance. You're not worried about how you're going to pay for the health insurance and pay for the non-covered expenses and what happens if your kids get sick. Limiting your own care because you're concerned about the cost. How freeing would that be? It's a freedom act to affect the quality of your personal life to reach your goals and dreams. This is our dollars shared for the same freedom that Canadians, that the Brits, that the Swedes, that the Italians, that the French all have, and all the other industrialized countries just for the privilege of living in that country. The critique? This is government-run health care as to what services are paid for and what services are available and death panels and how to access. But it's important to remember, not proposing government-run health care, but government-paid-for health care. Our tax dollars paying for the health care, but still private doctors, private hospitals. But you're going to say, Paul, he who pays the piper calls the tune. Well, frankly, we have dozens of health insurance companies that already have death panels. They have somebody in a back room whose salary depends on how much money they can save the company by deciding what services we're going to pay for, who gets paid, and who doesn't. And they're solely responsible to their own insurance company. Wouldn't it be better to have a government employee with open, transparent decisions whose salary doesn't depend on how much he makes profit, and who's responsible to the legislators that we elect? The other critique, medical industry, research and development needs profits to innovate. But we already use our money, or we have, to fund private research in public research in hospitals, the National Institute of Health, and we've developed a public-private partnership where these private companies can take the innovations that are come up with and make the drugs and do the other things that they can profit from. We did this in the 60s with the space program. We spent billions and billions and billions of dollars in our tax dollars trying to get to space. But what came out of that pure research? We came out with computers and materials and even Tang. All of the innovations of our modern economy came from that public investment in pure research. And who did we give it to? We gave it to private companies to innovate and profit. So, the Affordable Health Care Act was to balance these interests. So why has one side been hostile to the whole Obamacare and the Health Care Act? I believe it's pure politics and protection of a profit industry. This party had 4 election cycles to demonize, to get Americans worked up of government control of health care so they could get elected. Secondly, successful implementation of health care for Americans may lead a whole new generation to be supportive of the other party, like Social Security, a generation of Democratic supporters. Medicare, a generation of Democratic supporters, because that party looked out for them. What happens if everyone has health care? Who are they going to thank? Well, they're going to thank the folks that helped use their tax dollars for them. Finally, follow the money. Look at the campaign contributions of all of these legislators that are against these health care reforms. I bet you'll find some health insurance industry, I bet you'll find some pharmaceutical industry, and I bet you'll just find some medical device industries. These folks want to avoid contributions to Americans that would decrease their profits. And that's the debate. Do we do together, like we've decided with education, with military, and with infrastructure, pool our resources together and do together what we can't do individually? Or should I keep my money and only the deserving who can afford it should get to live longer, freer, and healthier? Thanks again for listening, and I look forward to hearing from you again. Next time, we're going to talk about entitlements and taxes. Thanks again.